everyone, it's Alicia, and today I'm joined with Dr. Bilski of Bilski Dental Group. How are you doing today?
Good afternoon.
Good. So in this video, we're talking about Zurich Crowns, and you make these right in your office. So you're gonna kind of walk us through that.
Yeah, we are. We have some photos if we want to go through that right now. That'd be a good idea. It makes it a little bit easier to give our little chit chat here. Funny thing that we hear all the time in the office is that patients will come in and they need a crown. Sometimes patients know it as a cap. We use both terms. Whoever we're speaking with makes it easier for us to move forward. But what we do is we use a computer. And on that computer, there's a camera, which I don't know if you can see very well. It's that white cord hanging off to the right. Shape the tooth the way we need it to be shaped. Then we take a picture. And then it gets sent over to the milling unit. So what we have is like a lathe. It's called a 3-axis CNC machine, which is used in a lot of businesses. And we've brought it into our practice and been using it well over 20, 25 years. So there's a little block that gets inserted in the center there. And then there are two arms or hands, if you will, that have drills that just kind of reshape this little block that you're going to see right here. That is a zirconia block, which is one of the stronger tooth colored materials that we can use. And it mills that in about 15 minutes. Once that's milled, it is sent over to, I call it the Easy Bake Oven. It's a kiln. It's a vacuum kiln. It's well over 1,300 degrees Fahrenheit. It solidifies the crystals that are made in that block, and it's very strong, very durable. Following that, this is what the tooth looks like. And I showed a yellow tooth because people think teeth are white, so they're not as white as that initial zirconia. Mm-hmm. But once it's fired properly, meaning vacuum fired in the kiln, the natural tooth color, which is representative of what the patient has. Right. There's 17 different colors that we can use. We can modify this tooth if we want to. Okay. This is all done within a 90-minute period. So it's one appointment under our roof. We don't have to send it to a laboratory. No temporary tooth or temporary cap or temporary crown. And then we are, again, pleasantly surprised by the amount of sensitivity that's reduced because it is done in one appointment and not multiple visits. So many times our patients will say, no, you can't do that. Or I went home, I told my wife or I told my husband that I had a tooth done in one day, and they said, no, there's no way you can do it. We've been doing it for well over 20 years. Okay.
So you have a lot of experience, and I love the fact that you have all the different colors that you can match specifically to whatever color teeth your patient has.
Correct, and that is an example of a molar, a first molar. That's the most commonly drilled, filled, root canal crown tooth in your mouth. Of course, we can do it with front teeth too. Right. We can make smile design teeth. Yeah. We can make them look pretty. We can change the color.
And it needs to match. If it's in the front, you don't have to be bright white, and then the rest maybe aren't as bright.
Exactly. So.
All right, wonderful. Well, thanks for telling us a little bit more about that. Like you said in the beginning, I didn't know what Zurich Crowns were and what that process looked like, and I'm sure a lot of our audience doesn't as well.
It's a great technology and innovation, and patients love it.
Wonderful. Well, if that sounds like something you're interested in finding out more about, you can get in contact with Dr. Bilski's office. You can give them a call, or you can explore their website online at bilskidental.com. Thanks again.
You're welcome. Thank you.